Hey everybody, this is Dr. Tom Iannello from the North Isle Wellness Center of Hope in Miller Place. I'm sitting here with Pat Lama. Pat's one of our heart sound recorder patients that we had a great experience with this year. And at this conference in Colorado, I wanted to be able to share with you some real truth about what happened with patients that have been doing the heart sound recorder since we started doing this in our office. So Pat, you had a history of fibrillation that you had ablation therapy for a number of years ago, right?
I also had 12 stints and ablation therapy,
Okay.
which I call open groin surgery.
Okay. So how long ago was that, Pat?
2004 for 7 stints and 2005 for 6 more.
Okay.
And then
What was the ablation therapy?
4 years ago, the ablation therapy.
Okay. So, Pat, he's a good patient. He does everything his doctor asked him to do, and he did. And he was having a rough time. I want to also mention that he was 90 pounds heavier than he is right now because we got him on a diet in our weight loss clinic. He did very well with Nadine this past year, so we're proud of him for losing about 90 pounds, Pat?
Yeah, 88 to be exact.
88, okay. So in the process of doing that, he jumped right on the heart sound recorder when we introduced it back in February of last year. It was almost about a year ago, Pat.
Yes, sir.
Yeah. So Pat's been under our heart sound recorder program for about 11 months. Now, the other thing that was interesting about Pat is he had unexplained bradycardia for years. His heart rate was around 44 to 46.
Yes, sir.
Right? Now, he's worked with cardiologists for 10, 15 years, his traditional medical doctor. Nobody ever found the cause of the bradycardia. Nobody ever addressed it. And when we put him on the heart sound recorder, we saw where the bradycardia was. You would watch his beat, and there was just a very long distance between the beats. Not fibrillation, but just too much length in the beat. So we put him on a program that he tested for using our methods. He's been religiously taking our nutrition for the last 11 years, and he was doing great. Little by little, his beats were coming up to 50, 56, 62. And then in November, he started getting a little bit too loose with his diet again. And he started having, remember, some sugar, a couple of little snacks here and there. And all of a sudden, his graph tanked. His bradycardia started coming back. His fibrillation, remember we had that problem when the fibrillation came back?
Yes, sir.
I actually got on the phone with Joe Antel that very week. You remember I got on the phone with Joe? And I said, Joe, I don't see the fibrillation. He goes, it's right there, Tom. It was very subtle, but it was just enough that it was starting to get irritated. But what was causing it was the sugar. So Pat, because Pat can only tolerate so much sugar, when he goes above a certain amount, his heart begins to shut down. Now, just as an aside, the thing that helped his heart get better was phosphorus. We put him on phosphorus, right, Pat?
Yes, sir.
Process. And little by little, his heart rate has been coming up, and he was in for an HSR, I think, either this week or last week, and his heart rate was 74.
Right.
Right, Pat?
Yeah, I'm worried about dropping it down again.
Right. So his bradycardia is gone. His fibrillation is gone. He's down 90 pounds. And how old are you, Pat, if I don't mind me asking?
I'm going to be 80 in August.
So here we are. I mean, don't tell me that people can't be changed and bodies can't be fixed. And, Pat's a great example of when you do the right thing, because he's a great patient. He does everything we ask him to do. And, I have to say, you're kind because you're always so grateful for what we do for you, and you're always so acknowledging. And I want to ask you also, so that we can tell the people in the audience, what do you think of Courtney? How does she run the machine? How does she take care of you back there?
She's very pleasant, very competent, and very, very professional.
That's it. So Courtney primarily takes care of Pat, and I'm back there to keep an eye on him, and I do nutritional response testing on him. But he knows what to do because both myself and Courtney are here to take care of him. And if anything ever comes up, he knows he can call us and we'll take care of him right away. So I have to say, he's probably one of the favorite patients in the office. All the girls seem to love you. I don't know why.
Yeah.
So I want to thank you for coming in and talking to us. Congratulations on the job well done. I'll answer any further questions you have about Pat while we're discussing him because I brought his graphs along as well, which we're going to be showing him, Pat. But I wanted you to know that these are real people with real health issues that have failed in traditional medicine and cardiology. And I would say, are you ecstatically happy with what you...
I'm able to go to the gym 5 days a week with no problem whatsoever. I don't even breathe on it. Great one.
His lifestyle is completely well, and I tell you, he's in much better shape than people half his age, and he did it all in about a year's time.
Yep.
And he's been very compliant. So again, congratulations, Pat. Job well done.
Good.
Great example for people watching out there today. So please, bring this to your patients as well, doctors, because you'll do them a great justice. Talk to you soon.
Thank you.
Bye-bye.
Thank
You're
you.
welcome, Pat. Oh,
There you
there
go.
you go. All right.